Good morning, everybody. I am Anuja Purohit from Radiance with You YouTube channel. I'm sure all of you must be keeping good health. Today, let's dive into a topic that affects a lot of people but often doesn't get enough attention. That is hair related disorders. Whether it is hair thinning, dandruff, or conditions like alopecia, these issues can have a big impact on both our physical health and emotional well being as well. And just like with fungal infection, the earlier we take actions, the better the result. Hair disorders can range from mild to severe, affecting people of all ages and backgrounds. Things like stress, hormonal changes, poor diet, or even environmental factors can contribute to hair problems. Some of the most common conditions include hair loss, both temporary and permanent, dandruff, scalp infections. These can cause discomfort, itching, and even embarrassment. But here's the good news. Just like with any health issue, awareness and early intervention are the key. We can take steps to prevent hair disorders before they start or at least minimize their impact. By understanding the cause, adopting healthy habits, and using the right treatment, we can protect our hair and maintain its health for the long term. Let's focus on how we can prevent hair related disorders, recognize the early signs, and explore the latest treatments and solutions that can help restore and maintain our hair health. Whether it's better scalp care, nutritional improvements, or seeking professional advice, we all have the power to care for our hair and keep it looking its best. And to do this, let's connect today with our skin expert, Dr. Sindhu Priya from Bangalore. Dr. Sindhu Priya is an MBBS, DDVL, FRGUHS in Trichology. She is highly qualified and experienced consultant dermatologist practicing in Bangalore. She is currently practicing as chief consultant at Dr. Sindhu's DERMA SOLUTIONS Skin, Hair and Cosmetology Clinic. So let's welcome our expert today. Welcome Dr. Sindhu Priya on our live session for Radiance for All YouTube channel.
Yeah, hi, good morning.
So it's pleasure to have you here, and let's start with today's topic, and that is hair care. So here's my first question to you. Doctor, which hair disorders are commonly seen in practice?
So, in the literature, not less than 40 to 50 or even more number of hair disorders are, documented or recorded. But when it comes to our practice, there are a few kind of hair disorders that are very commonly seen, and one should be very much thorough about diagnosing these conditions. That is, for example, if we can divide them into the adult, simply if we can just divide them in a pediatric age group and in an adult age group. So when it
Hmm.
comes to the pediatric age group, most commonly seen is mostly the non. We can simply classify it as a non-scarring as well as a scarring type. So the non-scarring type will be most commonly seen. That is the cradle cap, dandruff, seborrheic dermatitis, or in simple terms, just a greasy scalp is what we call. So when it comes to the fungal infections of the scalp, that is forms a very a part of almost around 30 to 40% of the times. It is mostly the non-scarring variety. Non-scarring, when I mean the non-scarring, it means it doesn't actually cause a irreversible damage to the scalp layers. But sometimes
Hmm.
there are one or two conditions in the fungal infections, that is Kirion is what we say. It is quite a
Hmm.
serious condition, most commonly seen in immunodeficiency or immunodeficiency age group, or where the nutrition status is not very good. In such kind of conditions, usually the most resistant fungus and tough and challenging fungal infections are most commonly seen. That is the Kirion, what we say. So this is,
Okay.
and yeah, a few cases of alopecia areata is also definitely seen. I have come across definitely such kind of conditions, especially when it is associated with conditions like atopic eczema. So there are
Okay.
certain factors, predisposing factors, like especially the female, and so some genetic factors are also there. So
Hmm.
considering all this and into our evaluation, treatment will be designed for every individual needs. So when it comes to the adults, most commonly, Again, simply we can tell it as non-scarring and scarring. So when it comes to a non-scarring variety of hair disorders, most commonly it is the female pattern or the androgenic alopecia, male pattern or the female pattern hair fall. It is a telogen effluvium, alopecia areata, and when it comes to the scarring type, it is most commonly the folliculitis decalvans, lichen planus pilaris, frontal fibrosing alopecia. Such kind of conditions are all usually seen, and discoid lupus erythematosus. All these conditions are usually seen. The other non-scarring variety is what we see in adults, in most commonly in people with any psychiatric issue, is trichotillomania, where they voluntarily try to pull their hair. So there is a lot of breakage, so that comes under a non-scarring alopecia. So these are the conditions what we usually see. So in the adult age group, more than 50 to 60 type of alopecias will be the telogen effluvium and the androgenic alopecia. And the
Okay.
other 25 to 30% is usually the alopecia areata variants. So again, the variants and the types will differ. Broadly, this is the classification.
Okay. So, doctor, how common is androgenic alopecia and male pattern hair loss and female pattern hair loss? What's the difference between them?
So androgenic alopecia, as the word itself means, androgens, it's just nothing but the
Okay.
hormones, the sex hormones, the androgens. So
Hmm.
when it comes to the how common it is, again we have to classify them based on their age group. So less
Okay.
than 20 years of age, for example, less than 20, we see only very less, like 10 to 15% of them. So when it is between 25 to your 50s, it is a very big spike. That is, we see almost 66% of the patients developing at this age group. Okay, when it is after 50 years, after we see around 40% of them developing at that age group. Okay, so this
Okay.
statistics is based on the age group that what we see. So why is this biggest spike that is happening in between 25 to 50 years is, as the name itself say, because hormones and genes have a lot of a very big role to play in to develop this kind of hair fall. So that is the
Okay.
reason why in this age group we see a massive spike. So and after 50 years also we see, but that is most commonly in the um, patients with any cardiac diseases, any atherosclerosis, or patients on hormone replacement therapies. In such kind of patients, we see androgenic alopecia. So those are all like
Okay.
exceptionals. So usually
Right.
patients have something else and they don't actually complain of hair fall. They have some other issues like hypertension or any other issues they'll be having, and after that taking those treatments they develop androgenic alopecia. So very rarely such people who they are not actually bothered about the hair because they're finished
Hmm.
cross 50 years of age group. So such kind of people kind of turn up to the OPDs very late, and they're just happy
Okay.
with just supplements or serums. They're just happy with that.
Right. So, in which age group is this type of alopecia very common?
As I've mentioned, telogen effluvium. Let's speak about telogen effluvium. It is very
Hmm.
common between 15 to 45 age group. It's very much
Right.
common.
Okay.
In
Yeah. Yeah.
androgenic
So,
alopecia, most common
hmm.
it's between 25 to 55 years of age group. But
Right.
people that
Okay.
are coming to our OPDs are a combination of these two, because
Right.
they might be having multiple predisposing factors, which is also including the genetic factors. So it is
Okay.
usually a combination of things. So if it is this
Right.
age group that is coming to my OPD, I usually tend to get a blood test. Of course, I counsel them
Hmm.
about the genes and hormones that is playing a very big role, but I tend to
Right.
get a complete blood checkup so that when we are giving
Okay.
them nutrition or when we are starting our treatments, all the small factors are taken care of.
Okay. Right. So, you told us about predisposing factors. So, what are the predisposing factors for this type of alopecia?
So, okay, when it comes to androgenic alopecia, predisposing factors are just two to three. That is
Hmm.
mainly genetic. That is the reason why it comes
Okay.
up in that. 20s to 50s age group. Most commonly, it is genetic, is the predisposing factors. So, morely because there is one of the most important receptor, that is the androgen receptor, that is coded by chromosome XQ12. That is somehow it becomes very, very hyperactive. And what happens, it is also mediated by the dihydrotestosterone. So sometimes it becomes very, very hyperactive. And because of this, what happens is the growing phase of the hair is shortened. Okay, the growth of the hair is compromised. We call it as anagen phase.
Okay.
It kind of shortens the growth phase. So what happens, the hair doesn't reach to its actual length. So it's just like starts growing. Suddenly it becomes small and it falls off. It detaches and it falls off. That is one
Okay.
of the reasons. The second part is a steroid harm. One of the steroid 5-alpha reductase receptor is another factor. In this receptor, what happens? It has a lot of affinity for testosterone. Because of its high affinity for testosterone, it continuously kind of converts excess amount of testosterone to dihydrotestosterone. And again, the same story continues, where anagen is shortened. So more of miniaturization of hair. The hair follicles become very tiny, 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 and they are automatically, the bulb is detached. Because of this, the hair follicle becomes empty and it is pushed to a state of dormancy. So that patch of the hair where this is actually happening becomes a very empty bald patch. This is what is seen. Okay, so that's why we say it in and scarcity. In telogen effluvium, it is more of increased hair fall numbers. So we have to differentiate between these things. Why? Because treatment. So usually we use a dermoscope or a trichoscope to actually see the follicles and assess the follicles. So we know what exactly is happening there. Usually in this age group, I'm only seeing a mixed picture. So mostly in the areas of the scalp, I'm seeing a mixed picture of everything. So because of which we can actually assess what category they are belonging to.
Okay. So I guess all this mechanism is at a very micro level. So is this type of hair loss related to any health disorder or any other medication?
Yes, definitely. In fact, both the kind what we commonly see, telogen effluvium and androgenic alopecia, is definitely related to health disorders. When we are speaking about androgen alopecia, people like testosterone replacement injections will be taking. So people with prostate cancer, benign prostate hypertrophy, people with PCOD, people with any thyroid issue like hypothyroidism, and people with coronary artery disease, people with hypertension, and also people with who are taking a lot of antidepressants, anti-anxiety medications, and people who are taking blood thinners, for example, blood thinners that they're taking. And a lot of people take a lot of steroids for like gym and bodybuilding. So all these things are there. So that is one thing. Another thing is chemotherapy. So people who are taking chemotherapy and it is inevitable. So in such kind of patients, it is mostly a mixed picture is usually seen. Hey, what happens is for these kind of people, it's not partly it is because of the existing disease that is causing the hair fall, and partly it is sometimes the drug that they are taking. It is kind of creating an imbalance. Because of this, there is a lot of even follicular miniaturization, or the follicles become very, very thin, and because of this also
All right. So this sounds like a very complicated thing to assess and also treat. So how is this type of alopecia managed, or how do you treat such mixed alopecia?
the first and foremost, when a patient is coming, the first and foremost thing that we usually do is a dermoscope, a basic microscopic examination. What is what we see? So we see the
Okay.
follicles, we see the distance between each follicle, and also we see the hair strands, and also we see if there's any breakage of hair strands, and also we see the thickness of the hair, like thickness of the
Hmm.
follicles, and how exactly it is. There is a certain biological reference to all these things. So all these things are evolved, and we kind of come to, we do hair pull test, hair tug test, all these things. We ask basic history of how many hair is lost per day.
Okay.
Basic history is done. Like how many hair is lost per day. If it is less than 100, in case of a telogen effluent, usually we
Hmm.
give assurance to the patient less than 100 is always fine. That is okay.
Okay.
If it is more than 100, that is when you have to be worried about. That is what the literature says. But people will
Hmm.
all if we say that, some patients might not be, might not be satisfied with this kind of answer. So what we say, we
Yeah.
at least start them off with supplements, and also basic hair care, basic serums and supplements is what we do.
Hmm.
So how do we manage? After diagnosing what is what, at times, if the age is little high, I also do a scalp biopsy where a small amount of skin is taken to the lab and also given for testing. Because after 50 years
Okay.
of age, there is a pathophysiology called fibrosis. So because of fibrosis also, that is physiological fibrosis that is happening in the scalp. Because of the fibrosis, there's a lot of tightness in the scalp, due to which there
Hmm.
is not enough adequate space for the hair follicle to grow. That
Okay.
situation also we have to tackle.
Right.
In such kind of
Okay.
conditions, so based on what category it is, I kind of design my treatments. So for
Okay.
example, if it is an alopecia alopecia means alopecia means oral finasteride preparations are also available, and even better, dutasteride injections are also available in the market as of now.
Okay.
Okay, so
Right.
that
So, how
yeah,
commonly these scalp injections are used for alopecia? You mentioned about injections. So, how commonly are they used?
scalp injections, as of right now, there are a
Yes.
lot of scalp injections that is available in the market. Okay, the
Okay.
scalp, some of the scalp injections are our own blood, derived from
Hmm.
our own blood. That is the growth factor concentrate, is that's we call it. That is the
Right.
PRP, the that is GFC, growth factor concentrate, and also the latest in the market is nanofat, where we take the patient's own fat and we kind
Hmm.
of process it properly so as to get the liquid fat, and that is injected to the scalp. That is the nanofat technology, and it is considered to be the most one of the best and the most efficacious ones, because even scarring alopecia also can be treated in this kind of conditions. So that is what it is.
Okay.
So the other kind of
Right.
scalp injections when we are talking about is steroid injection, that is commonly gold standard triamcinolone injections. The
Hmm.
triamcinolone injections is used to tackle alopecia areata. That is a triamcinolone injection that we are using here. So alopecia areata is
Okay.
nothing but patchy hair loss. So if it is less than 40% of the scalp is involved, we give
Hmm.
a triamcinolone injection, that is 10 milligram per 10 milligram per ml we give. And also we also, if it was for the face, we give 5 milligram, that is a diluted form is what we are. So
Okay.
when it comes to such kind of situation, so the others is for, especially from telogen effluvium, where patient doesn't actually want to give their blood, but they just want some
Hmm.
treatment to the scalp. So there are some extracts, that is the plant or the potato derived extracts. So they process some multivitamins and growth factors, multivitamins and nutrients out of these extracts. So because of this,
Okay.
we call it as mesotherapy, or a cocktail, hair cocktail is what we call. So these growth
Oh.
factors, there are small injections, we put it all over the scalp, we put it, so that the patient is also very much comfortable, and there are tiny injections, usually not much of pain, so patient is also very much the acceptability is pretty good. What I'm seeing
Right.
in my practice. One more is exosomes. Exosomes is also one of the latest in the market, where they're just transit molecules that helps in better delivery of nucleic acids and vitamins and whatever the multi-nutrients that is required for maintaining a good scalp health. So they are exosomes.
Okay.
The other one is dutasteride, plain dutasteride 0.1 ml solution, or one more thing is a combination of exosomes as well as dutasteride that is available in the market, and also that is shown to be of very good efficacy. So these scalp injection, so basically if the diagnosis is good and the patient compliability is good, we can design what kind of scalp injections that we have to give to the patient. Usually we give once in a month, once in 4 to 6 weeks. That is how
Okay.
we plan.
Right. So how we see hair growth after all these injections and all the treatment plan you provide to your patient?
Mhm. See, treating hair fall is never one approach. Treating hair fall
Yes.
is not only the doctor's job, it's not only the treatments that we're doing in the clinic, because they're with us for once in 30 days. The rest 29 days, the hair has to be looked after. That is, we give
Yes.
some supplements like biotin, or in the latest in the market is cyclical hair nutrition therapy, where it's a balance of all the essential proteins, the omega fatty acids, and also the micronutrients that the patient is getting on regular intervals of times. And it is properly
Okay.
coded as to which date what is supposed to be taken, so the patient doesn't misses out anything. This is one of
Okay.
the most best and most compliable, wonderful thing that I have recently seen, and also and I'm making sure the patient is taking it on time. The other thing is
Right.
Retensil, Procapil, and Capixil, and a lot of all these things in adenosine. All these topical preparations are available in the form of serums in the market. So all these peptide serums along with topical minoxidil with finasteride, all these combinations, and whatever we give, all is even the hair care that we give, the shampoos and all these that we give, it has to go regularly to the patient, so that whatever, not only the in-clinic treatments, even their home care is as much as essential. And also one more thing
Yes.
is so everything everything if it is taken on time, we usually expect good hair growth between 2 to 3 months. Yeah. So
Oh,
it will
okay.
happen very slowly, because one hair cycle itself is around 3 to 4 months. So we need minimum that much amount of time to see proper hair
Hmm.
growth.
Okay.
Yes.
Right. So, doctor, how commonly is hair transplant done for hair loss and especially in cases of alopecia?
So the hair transplant, when it comes to hair transplant, usually, as I told you, the peak is in the middle age group. Okay, so that
Hmm.
is between 25 to 50. So these are the people who are very much concerned about their maintaining their frontal hairline, because most of them are
Yes.
marriageable age groups. So in such kind of people, so how often, see, hair transplant is again a long-term commitment, and also finances, you have to say it properly. So hair
Yes.
transplant. So in this 25 to 50 years of age group, hair transplant, almost 35 to 40% of the people would want to opt for a hair transplant. One thing is because of their marriageable age and good financial stability, and one more thing is they also think about the longer term, because they want to restore that
Hmm.
hair volume, so that they knew in the longer term it's going to be useful for them.
Yes.
Yes, Nick. Yeah, and when it comes to the females, females are also nowadays opting for a good hair transplant. Why? Because they know that instead of taking a lot of injections and all that, so they are also taking a bold step, and also they are also going into hair transplant. So usually the females, the frontal line is the hairline is usually maintained, but the central part of the hair, the scalp has shows lot of thinning and balding. In such kind of cases,
Okay.
there is meticulously done. Females also go, though the percentage is little lesser, but of late we are
Hmm.
also seeing. So I can say around 15% of them are plan for hair transplant. Maybe
Okay.
10 to 50. That's it.
Right, right. Okay. So, doctor, what are the chances of recurrent hair loss even after such treatments?
See, first of all, we need to know what recurrence hair fall, almost around 50 to 60% of the times. What is the cause of recurrence hair fall is they're not compliable to the treatment. So, as I just previously
Right,
mentioned to you, is uh, it's a long term commitment with the doctor when you are going for a hair transplant, okay, or a hair
right.
treatment. For example, just PRP or GFC, we usually suggest 6 to 8 sessions. Sometimes I've also extended
Hmm.
to 10 sessions. Okay, see, it's basically a long-term commitment with the doctor. So most of them they fail to come back to for multiple sessions due to multiple reasons. Maybe they're relocating, maybe the financial constraints. Because of multiple reasons, they fail to adhere to the treatment. And secondly, the home care that we provide, they fail to do it on a regular basis. So every little amount
Right,
of serum or minoxidil that you're applying every day does make a lot of difference. So, and minoxidil also, it is a lifelong commitment, is what we say. As long as you want hair, you have to apply topical minoxidil. So, most of the people they
okay,
kind of give up very much in the midway itself. So, that is one of the major factors. One more thing is if they don't actually take guidance from a dermatologist and they just see some quack who's not even qualified and they would not have treated them properly. So that is one of the reasons where recurrence chances is very high. And thirdly,
right.
for example, the clinician who is treating them is getting maybe sometimes two conditions might be overlapping. For example, a diffuse alopecia case areata can present as telogen effluvium. So somehow, if it is not picked up during clinical evaluation, that time recurrence chances is very high. Okay. And what
Okay,
happens, and suddenly in some females, what we have seen, they were on minoxidil, and suddenly now they have conceived, and they don't want to continue with minoxidil because suddenly they have
hmm.
conceived. And then at that time, they have no other option. That time, hair fall again will become a recurrence factor in such kind of cases. And
Okay,
unstable alopecia areata, where it is one case where more than 50% of the scalp, if it is involved, the recurrence chances is very, very high because it's usually resistant and not very favorable with current kind of treatments.
okay, right, okay. So, how common is alopecia areata?
So prevalence in alopecia areata will be around somewhere between 2 to 4% is the prevalence. But amongst the hair
Okay,
fall, if you are classifying it as a hair disorder, and amongst the hair disorders, it comes up to around somewhere between 25 to 30% of the cases will be alopecia areata. So again, we
okay,
have four different types of alopecia areata. One is alopecia areata, that is small, tiny patches. The second is alopecia totalis, where the entire scalp is kind of like the entire scalp is bald. Third one is alopecia universalis, where even the eyebrow hair and even the eyelash hair is also lost. And one more is diffuse
okay,
alopecia areata, where it usually mimics like a telogen effluve. So that is one of the
right,
different types of alopecia areata there. So usually the
okay,
alopecia totalis and alopecia universalis, the chance of recurrent rate is usually very high. So in such kind of condition, either a heavy dose of immunosuppressants along with a maintenance dose of immunosuppressants has to be done, or if not, the best option will be any like artificial hair, like wigs and or hair extensions and all. For example, if the eyebrow is lost, semi-permanent makeup, all these things can be done.
okay. So, how all these kind of alopecia areata are managed?
So managing alopecia areata is again like what we do. We try to assess in which stage it is. Okay, if it is less than 40%, we try to give
Hmm.
only scalp injections, and we also give
Okay,
things like topically we give minoxidil, tacrolimus, salicylic acid, azelaic acid, and tretinoin. There are a lot of preparations that is available in the market. Some of them can cause irritation, so that's what we need to advise the patient properly, and we have to give the patient like morning one molecule and night one molecule based on their compliance. We need to give the patient. Okay, and also some hair serums also. Mildly, it might be useful, but most commonly immunosuppressants like intralesional steroids, triamcinolone intralesional steroids are only one of the like gold standard is what is. So along with that, now it is JAK kinase inhibitors, that is tofacitinib is also one of the latest trend in the market. But I it is but in my practice, oral steroids have shown me the most promising results. That is the betamethasone we can give, and also we can other molecules can be given like cyclosporin and methotrexate have been tried. I've been happy with the results that I've seen with cyclosporin. So I don't give just the cyclosporin. I always give it as along with the pulse dose of a steroid. So in the pediatric age
Right.
groups, what I've previously handled, cyclosporin has given me a good results. So, and the other
Okay.
thing was there is IV infusion of steroid infusion is what we do. So methylprednisolone steroid infusion, once in a month we give a very high dose of steroid, that is we infuse the steroid to the patient, calculations based on the patient's total body weight, and make sure
Hmm.
there is no other comorbidities that is considered. So the patient selection is very, very important for this kind of treatments. So it is usually
Right.
slow infusion is what we give, and the rest of the time either we give cyclosporin tablets is what we give. And also other thing that is come up is the NBUVB therapy. NBUV scalp NBUV therapy is what is the latest that has come, and some people have already started that scalp NBUV therapy. But again, the results are very, very much variant. So one more
Okay.
important thing we have to do is fungal spore we have to do before before completely considering it as an alopecia areata patch, especially in pediatric age group. We have to rule out. We have to take a fungal culture and make sure it is no active fungal infections are there. So as whatever the treatments that we design, it is like the patient actually responds properly with it. So that
Hmm.
is one of the major important things. And yeah, and make sure most of the times alopecia areata is always associated with, not always, but on it is maybe 40 to 50% of the times it is associated with any other autoimmune disorders. So we need to consider all
Okay.
those things. We need to do a complete blood checkup, complete body evaluation has to be done, so as to make sure there is no other underlying silent co-mobs are there. And that has to be, whatever it is, multidisciplinary approach should be there so that all these things are taken care of.
Right. So, doctor, are there any side effects of such treatment of any kind of alopecia?
See, side effects of treatment will be, see, one thing is minoxidil. Commonly, what we
Hmm.
see is minoxidil. Minoxidil might cause maybe 10 to 15% of the time people may be allergic to minoxidil. In such cases,
Okay.
no matter which brand of minoxidil you are giving, they might be having some kind of sensitivity where it is shown on the scalp and all over the face and even over the neck and the back. Lot of sensitivity will be seen. In such kind of people, we try not a liquid or solution form. We try to give a foam, but that has worked out in some cases and not worked out in some cases for me. In such
Okay.
cases, I only give them only peptides like procapil, redenzel, adenosine, and all these things like serums or growth factor peptides formulations only I give, and I safely call them for GFC treatment. That is,
Right.
minoxidil is one of the things that is causing a lot of side effects. So the other thing is side effects that might be caused because of mainly because of steroids when we are giving. So steroids when we are giving, side effects could be again the GI side effects could be there, weight gain, water retention, all these things might be there when we are talking about steroid side effects. All these Cushingoid phases and all that, what we have been speaking about, and there's a lot in the literature. We see them in daily practices also. These side effects are usually
Okay.
there, and also there might be some uh, electrolyte, some side effects with cyclosporin also, with BP fluctuations also might be there with cyclosporin, and serum creat and all these things we have to consider when we are starting with cyclosporin. And the other thing is because of injections also, some people um, very rarely mesotherapy, when we are giving mesotherapy injections also, it's only because some people do have some sensitivity towards it, or the other side effect is only the pain after any GFC procedure. They might have some pain, and that pain is very very transient, maybe for a day or two it is there. So we usually give a painkiller, and most of the times they are comfortable.
Right. So, doctor, what are the common challenges in the management of alopecia?
The common challenges that we face is alopecia areata is they're having some other comorbidities that is associated with alopecia areata. So it's very hard.
Hmm.
We go for a multidisciplinary approach where a surgeon or a physician will be will also be with us to treat the underlying uh, associated disease. So that will be the thing.
Okay.
So alopecia areata, it is never what you say like a textbook. Like it is sometimes we will have to do a trial and error technique to, if we have to change the
Right.
drug, if they are not responding well to steroid, or if they are having a lot of side effects because of the steroid, we might have to change the drug to some other drug. So that and all we need
Okay.
to counsel the patient very well before only. And yeah, when it comes to AGA and all, like androgenic alopecia, like the results are little delayed, and the results are only consistency and time. Patience, consistency and time is what that is important. The results will be there, but once you stop being consistent with your hair care, there again there's automatically again there is a lot of hair fall. So
Right.
that is the one more thing. Though we tell the patients a lot of times, they will not be happy. So if they're not happy in here in this clinic, or they'll never be happy anywhere. That is the thing. So we definitely tell the patients this is the gold standard, what every dermatologist is going to tell you. You
Okay.
have to be very very consistent with your hair care practices. Is that one
Right.
thing we tell. The other challenges is what we tell. For example, I do have some clients that is visiting me from abroad. Such people, doctor, I can't come once in a month. That is the thing. You're
Hmm.
telling JFC, I can't come once in a month. And yeah, I cannot take hair transplant because I'm not there here for a long period of time. I have come here only,
Okay.
I visit here only once in 6 months or once in 7 months. That is when I visit. So for such kind of patients, nano fat transfer is what one of the best option is what I can give. Nothing is working. Again, hair cosmetics like is what wigs or hair extensions or all these kind of things we have to advise. So it is
Okay.
more than the challenges we face is morely like their compliance with long term treatments. That is the challenges
Right.
that we are facing.
Okay. So how much recurrence alopecia areata? How much frequently alopecia areata recurs?
Alopecia areata is one condition where, see, if less than 50% of the scalp is involved, if 50% of the scalp is involved, usually the recurrence rate is very less. But more than
Hmm.
50% of the scalp is involved, again, 70% of the time the patient heals. But 30% of the time recurrence is there, because in such condition, it is a burnt out case. It is like very much resistant to any form of drug. Okay, so that
Okay.
the other 70% of the cases recurrence is there. So what we have to do, there is a saying that you need, when the patient is with you and you know that it is a severe case of alopecia areata, you need to hit hard. That is, we need to put high doses of, we usually give high doses of steroid after proper evaluation, and also adequate doses of immunosuppressants, like in a combination form we have to give. And also, there is also some laser treatments, that is microneedling and fractional CO2 laser have also been tried for such kind of alopecia cases. And I must say there are promising results for such kind of cases. That one thing. And also, so they can recur. There is an 80% chance that this group also can recur. For that, there has to be a tapered down maintenance dose of steroids or whatever the immunosuppressants they are responding well to. And yes, so
Okay.
topically minoxidil with finasteride definitely has to go every single day. So even supplements like biotin or vitamin D, all these also has to go in the proper period of time, that it will be a part of our prescription. So recurrence is not a rare thing that we see. It's a very, very common thing that we are seeing. So it's just a long term keeping the patients in loop for a longer period of time, and like multiple calls, like multiple once in a month we call them and we check with them like how you are doing, and do you see any result, or is it worsening. All these things, even there's a lot of homework that we do from the clinic side so as to keep the patient in loop.
Okay. So, doctor, are there any measures by which hair loss can be reduced or prevented, not just in case of alopecia, but in general also? It may be due to stress or it may be due to any weather condition. So, what can we do to reduce our hair loss or prevent it?
First of all, the patient should know when exactly they have to meet a dermatologist or a dermatologist. See, first of all, if you're losing less than 100 hair, you no need to worry. You can just it is a normal thing that is happening. It is more than 80 to 100 hair that is lost per day. That is when you have to actually consult a dermatologist. Okay. So
Okay.
when you consult it, most of the times people are not even aware that they're having an ongoing hair fall actually. They just think that my father had this kind of hair fall, so I may also be having the same kind of hair fall. My father also did many
Hmm.
things, so no, nothing came out of it. So I think it will be the same story for me. They might be thinking all this, or my relative did so many things. They have spent so much money, but there was no use out of it. So that mindset has to be changed because we have a lot of advanced treatments right now in the market. So we need to visit a
Hmm.
proper consultant, proper dermatologist who is really experienced in treating such kind of hair disorders. So that is one thing. Meanwhile, what is the rest people who just with simple hair care practices, hair fall can be reduced, like reducing the sleep, I mean, reducing stress, proper quality sleep. When you're going out, you can just wear a hat and go so that if there's any bald patches, they're not frequently exposed to the sun. And when it comes to
Okay.
your shampoo and conditioner, use proper shampoos and conditioner like that is sulfate free. There are a lot of options that is available in the market. And so when you're oiling your hair, just oil your hair just 2 hours before head bath, just with coconut oil. People use all kind of oils like castor oil, almond oil. I mean, castor oil, especially, it's used in most commonly in the urban side and the villages side, but that is not a
Hmm.
good practice actually. In fact, it will create more hair fall. In fact, and
Okay.
so some oil massage, anything, just 1 hour before head bath for 10-15 minutes, that will kind of improve the blood circulation to the hair. So, and eating right, eating nutritious food, and most of the people don't eat micronutrients, that is zinc, copper, selenium, and all that. That is mostly present in this flax seeds, dry fruits, and pumpkin seeds. So eating right, that is one of the main important. And in India, most of them are the females are iron and vitamin D deficient, sometimes even B12
Yes.
deficient also. So these micronutrients have to be properly corrected. First of all, so whoever is coming to me with a hair fall issue, I kind of do a complete hormonal as well as micronutrient analysis so as to make sure I'm not missing anything. And most of the time, when people are combing the hair, they have some slight amount of pain on the scalp. So they kind of ignore it. So when such kind of thing is there, that is active microinflammation that is happening around the hair follicle. So immediately
Okay.
you'll have to visit the doctor at that time. Okay, that is not something to be taken lightly. Need to immediately visit the doctor. So we can do usually we put topical steroid lotions is what we give to reduce the microinflammation, and also we give some
Hmm.
nutrients we give. So that is a thing. And also the other thing is lot of styling, lot of pulling of the hair. Also a lot of styling practices they do. It's not professionally done, so it might cause permanent damage to the hair. So such styling practice like constantly curling of the hair, straightening of the hair. See, when it is not required, you no need to do it. You can just maintain your natural hair. Okay, a lot of pulling and tucking of the hair if it is done. Such kind of things can happen. And also the pillow cover has to be very, very clean, because even a dirty pillow cover can also predispose to dandruff, and dandruff again will cause a lot of
Okay.
microinflammation and hair fall. So it makes the
Right.
scalp very
Okay.
oily, kind of causing infections. So these kind of, so
Okay.
avoid smoking and alcohol intake, because they also cause a lot of free radical damage to the hair, kind of It's suggested that they actually kind of create certain pores in the deep layers of the hair structure. So we need to be very, very careful when we are when if we want to restore our hair volume. So if you feel the
Okay.
hairline is actually receding, there's nothing to be ashamed or worried about. With the current treatments, visit a dermatologist, proper qualified dermatologist. So they will be able to guide you what exactly the treatment course of treatment would be.
Right. Okay. Doctor, we also have questions from some of our viewers. Ankit Chaurasia is
Okay.
asking, how often should we wash our hair to keep it healthy? Ma'am, I'm audible to you?
Yes, can you listen to me?
Yes. Okay.
Yeah, can you listen to me?
So,
Sorry. Yes, tell me.
yes. One of our viewer, Ankit Chaurasia, is asking, how often should we wash our hair to keep it healthy?
Usually, it is only twice a week we need to wash our hair. So, if the area, the locality you are staying is very has a lot of salt-rich water, make sure you use water softeners in your water pipes, so as the
Okay.
hair fall is reduced.
Right. Okay. Rekha Tirke is asking, can seasonal changes affect hair health?
Yes, definitely. In summer seasons, the oil glands in the scalp they become very, very hyperactive, and they kind of
Okay.
cause seborrheic, that is dandruff issues is most commonly seen. So because of this also we can see a lot of hair fall. Okay,
Hmm.
and the other one is um, during winter, that is extreme dryness, that we see a lot of hair breakage is seen. So during winter I
Okay.
usually suggest patients to use a leave-on conditioner. It's like a moisturizer for the scalp, a leave-on serum, just so as to moisturize the hair follicles, especially the ends of the hair follicles, so split ends can be avoided.
Okay. Chandramani Vishwakarma is asking, how beneficial is regular scalp massage for hair growth?
Regular scalp massage regularly means just like twice a week. It is, yeah, it kind of improves the blood circulation. So the nutrients that is
Hmm.
reaching to the scalp is like, delivered in a more efficient way. So definitely it will have
Okay.
its own effect. And to tackle that, we have also introduced low level light therapy to our patients. It's like low level light therapy kind of decreases the inflammation and promotes blood circulation to the scalp.
Ma'am, am I audible? So, viewers, we really had a very great conversation with Dr. Sindhu Priya regarding alopecia and many other hair disorders or hair conditions where we can improve our hair health by not just taking proper meal, proper sleep, but also consulting an expert dermatologist at right time. And we should really thank Dr. Sindhu Priya for such a valuable time and insightful information. It has been very informative session for all of our viewers, and it is great to have Dr. Sindhu Priya with us today. And we really look forward for many such sessions for our viewers in coming time. Thank you, viewers, for your participation for today's session. Stay connected to our channel and do not forget to subscribe our channel Radiance with You. See you in the next video very soon. Till then, I, Anuja Purohit, signing off. Thank you and have a great day ahead.